Hey YouTube, it's Dr. Havercorn with River City Oral and Maxillofacial Surgery in San Antonio, Texas. Um, I've put out several videos here recently, but I got one more that I want to talk about. And hey, look, I've been out of town, haven't been able to make any videos, so I got a lot to talk about, and I like to hear myself talk. Anyway, sorry. Um, this is a video about a touchy subject, and I'm going to try and be a little diplomatic here, but I got some very strong feelings about this. Last night I was driving home, and I heard on the local radio station an ad for a dentist here in town. And it was an announcer, a voiceover kind of person doing the ad. It wasn't the dentist himself, but the ad said that this doctor is a good dentist and a good oral surgeon or a great oral surgeon or something along those lines. But it said oral surgeon. The guy's not an oral surgeon, okay? He does oral surgery in his office, I'm sure. I don't know him, so I can't tell you. But I can tell you this. He did not go to an oral surgery residency program. He's not a board certified oral surgeon. And the reason I'm not telling you the guy's name is because I don't want to pick on one person in particular. This is common throughout the United States. I've talked to oral surgeons in all kinds of markets, and this is just common. In the medical world, things are getting more and more specialized. Every patient wants to see a specialist and a subspecialist, and primary guys are doing less and less in some way. And I'm not trying to throw the primary guys under the bus at all. If your primary care doctor is qualified to do something, fine, okay. But back in the day, the family doctor took out your appendix, delivered your babies, did your C-section, all that kind of stuff. Those days are behind us. Everybody wants a specialist these days. But in the dental world, things are opposite. The dental world, the specialists are getting kind of pushed out and disappear, or not disappearing, but the model is more for the general dentist to do more and more, whether the dentist himself is doing it or they're bringing specialists to their office, or even worse, they're bringing people in who present themselves as specialists, but aren't actually specialists. And they kind of skirt around the issue and describe themselves as, oh, I like doing oral surgery, or I do oral surgery, or I limit my practice to oral surgery or endodontics or periodontics or whatever, but they're not actual specialists. So it just gets under my skin when I see stuff like that. It is, in my opinion, false advertising. There are laws in the state of Texas and most states about how you can advertise as a dentist or a physician, that are different from the public at large, just advertising some other type of business. And some of those laws have been challenged in the last couple of years at the court, in the courts. Not too long ago, a couple of years ago in Texas, a U.S. court ruled, and then a U.S. appeals court upheld the ruling that a dentist in Texas could advertise themselves as a bona fide specialist in specialties that are not recognized by the ADA. And there are actually some legal theories there that I honestly agree with. I don't think that we should keep people from advertising. I think there's a free speech issue there, okay? So I'm maybe talking out of both sides of my mouth, but there's a free speech issue there. However, I may not want the government to come put a gun to your head and force you to say something or not say something. However, I think the free market is the perfect place to handle this. And so I'm making a video about it, and I'm letting the public know about it. There are right now, I think, 9 officially recognized specialties from the American Dental Association. Those are actual specialties where you go to a residency program that's at least a couple years long, and in my case, 6 years long, including medical school. It is possible to get a board certification now in some unrecognized specialties that you basically attend classes in a hotel or at a dental school somewhere, and then sit for a board. And look, I know those guys put a lot of time into that, but it is not the same thing as a residency. Let's just be honest. Anyway, that's not exactly what this guy that I heard on the radio last night was doing, though. He was saying he's an oral surgeon. Oral surgery is a recognized specialty, but he's not an oral surgeon. In Texas, if you make an ad like that, you have to be very clear that you're a general dentist. And I just want you guys, the public at large, to be aware that, first off, there are recognized specialties from the ADA that require a residency and a board certification, or they don't require a board certification to practice them, but it's available. And I want you to be aware that there are people out there who are trying to present themselves as experts and specialists in something that haven't done a residency. And then that gets into that whole free speech argument about whether or not you can be an expert or whatever and not do a residency. And that's not the point of this. You just, as a consumer, as a patient, you need to know the credentials of the person working on you. And I not uncommonly see patients in the ER, in the emergency room, who have been treated by another dentist or dental specialist and have had complications. And eventually, when no one else can figure it out, they end up in the ER. And then I'm on call, and so I get called in to see it. And I would say that this happens more than once a month, which doesn't sound like a whole lot, but when you start thinking about it, if you're a patient that has had surgery and ultimately nobody can help you and you end up in the ER, that's a bad feeling and a bad place to be. Okay. And it's expensive too. And it didn't need to be expensive like that anyway. But when you see a dental practitioner and they are going to do a procedure on you, you need to know their credentials. And I would ask them what's going to happen if there's an emergency. Who is going to treat me? And then if you are having a complication and it is difficult and you're not getting answers about it and it is dragging on, you need to ask for a referral to somebody else, or you need to find somebody else and get another opinion. Typically what I see a lot in dentistry is that antibiotics are the answer for every complication, and people get antibiotics and they get Paradex or chlorhexidine mouth rinse, and that is the treatment for all complications. It is not always the treatment for all complications. Okay. So please, if you're having problems, get some help. And if we can help you, we will. But bottom line, know the credentials of the person working on you. Realize that there are actual specialties out there. Specialists have complications too. Okay. I have complications when I take out teeth. I have complications when I put in dental implants. Endodontists have complications when they do root canals. Periodontists have complications. Orthodontists, everybody has complications. Okay. But a specialist ought to have a better idea about how to manage those complications. They ought to detect the problems earlier, and they ought to, if they can't handle it, get you to the right place. Okay. So there is a real benefit to seeing a specialist when you need a procedure, whether it's medical or dental. Okay. And like I said, in the medical world, you don't have general practitioners trying to do specialized stuff. But, so look at that. And then specific to the oral surgery world, another thing I would check with when you're having oral surgery done anywhere, ask your oral surgeon. So first off, it's a good thing if they're board certified or board eligible. So a recent graduate from oral surgery, they need about 2 years before they can get board certified. And so during that time, we call them board eligible. Now look, if they've been out for 20 years and they're still board eligible, they just haven't done the board. The board exam does not guarantee that you're a good surgeon. Okay. I understand that and I know that, but just look, it's one hurdle that you can look at. So, okay, is your oral surgeon board certified? And then secondly, does your oral surgeon have unrestricted privileges at a local hospital? Okay. Because if you have a serious complication, you're going to probably end up in the hospital one way or the other. That is not common. Okay. Don't freak out. It's not common, but it could happen. And if your oral surgeon does not have privileges to come in and do surgery and treat you and write notes and discharge you and admit you and all of that, and some guys may not have admitting and discharge privileges, but your surgeon needs to have privileges to use the operating room at a local hospital. If not, and you end up in the hospital, then they're going to be calling somebody like me who does have the privileges and does take the call. And I'm happy to help you, but I don't know you. I didn't do your original surgery. I don't know what happened during your original surgery. So I'm now trying to kind of like pick up the pieces. And it's a lot easier if I was involved from the start. So if you're going to have oral surgery done, I would make sure that that guy has, and I mean even simple oral surgery, like an extraction, wisdom teeth, or one implant. Make sure that guy has privileges at a local hospital and could treat you there if he needs to. I know good oral surgeons who may not, but I'm telling you, if my family needed surgery, that's one thing we would look at. That's how, you're trying to pick an oral surgeon, that's one way we would do it. And then if you're going to a dentist who is trying to pass himself off or herself off as a specialist that they are not, man, that's a big red flag to me. It is possible to be an outstanding general dentist who does a great job for people and not misrepresent yourself. Okay? It is perfectly possible to be a successful businessman and a good doctor and not misrepresent yourself. I am trying not to misrepresent anything to you guys, and I would expect the same from my colleagues. So I'll get off my horse here and stop the rant, and give me your comments below. Thanks. Bye.